I'm Larry Wolf. I am the Residency Program Director in Internal Medicine here at Maimonides. So our residents get a really good exposure, I think, to all of the subspecialties of internal medicine, and they get all that exposure here on site. They get a lot of intensive care experience, a lot of critical care experience. They see a broad breadth of patients with cardiac issues, geriatrics, palliative medicine, rheumatology, endocrinology, nephrology, gastroenterology, and infectious diseases.
A characteristic of this institution that is really good for training programs is the very high volume of patients that we have here. If you pull out a textbook, pick a chapter, it's overwhelmingly likely we've seen that illness, whatever it may be.
We have a very unique patient population in that we have a very high acuity level. A lot of the time the residents will have to take care of patients where in other places they might be in an ICU setting. Here, there's only a limited number of beds, so sometimes we have to work with what we have and we take care of really sick patients on the floor.
The most important thing for me was to be at a place that had a large diversity in patient population. So to be in Maimonides with Sunset Park right here, as well as Borough Park, and all the different parts of Brooklyn, I thought that the learning opportunity and the ability to forge relationships with various types of people as patients was of paramount importance to me.
Just because of where we are and what the population that Maimonides serves, we see a wide variety of pathology, a wide variety of cases from across the world. Be it infectious, be it cancer-related, all kinds of pathologies. So we do get a really good mix of enriching clinical experiences across the board from around the world.
We see some extremely rare things that are incredibly interesting.
Malaria, typhoid, whatever infection we can think of, we have seen multiple cases of that here.
We see a lot of tropical diseases, which you usually do not see in the US at all. So that's very interesting. I haven't heard from other friends they have had the same experience.
We take away experiences, not just clinical experiences, but also life experiences from people from all around the world, and that enriches us as physicians and as people, and I think that's the most important thing in my own development and in any resident's development.
So our program's curriculum is heavy on the clinical base. Our residents start out in their first year spending a lot of time on the medical floors, and of course have a significant amount of time in the primary care clinic. As the years go on, in the second year, the residents also have the additional experience of working in the emergency department as well as in the cardiac intensive care unit. And then as a third-year resident, that's when you're functioning really as the role model for everybody else. You're running the show on the floors. You're what we call the senior educational resident when you're on the floors, which means that you're running not only the day-to-day workings of the medical floor, but you're running the educational program for all the junior residents and medical students.
As you go from an intern to a junior resident to a senior resident, your roles become more defined, and as an intern you really have a lot of support from faculty, from your senior resident, from your junior resident, and as you become a junior resident you take on more responsibility, and as the senior resident you pretty much run a team of residents and interns, which is really very important when you are potentially going to become a fellow in any subspecialty or an attending.
One of the things that I'm really proud of in this program is what's called the Humanism project. We teach them concepts around communication skills with patients and families, but we also talk about biomedical ethics, understanding unconscious bias, and talk about self-care for the residents themselves. This curriculum is incredibly innovative, and it's a really exciting part of our curriculum here.
So the attendings are very approachable. I've had wonderful interactions with a lot of them, and they always try to help us in our growth, our own growth, our personal growth. They always check up on you, and especially our program leadership, is an amazing cohort of people who've been at Maimonides for such a long time that you feel like you're a part of the family.
There are several members of the faculty who have been here at least since I was a resident, and I did my residency in the late 1980s. That is a sign right away that the faculty members have a real interest in and passion for teaching.
There is a wide range of fellowships here, ranging from cardiology, pulmonary critical care, GI, HEMONC. Almost all the fellowships that one would aspire to do are here. So that was one of the things as well, being in the hospital, being involved. We do subspecialty clinics as well, we do electives as well, so it kind of helps us connect with all the fellows and the attendings pretty early on.
Every hospital is a hospital, but the people are what make each hospital different. When I stop to reflect on what I am now, and I'm like, wow, this has really been a journey, because the way I've changed, the way I think, someone tells me one thing and before I know it, 5 things are in my mind and this is what it is. Unlike when I was an intern.
I say every person you will encounter here will be very welcoming. They will make you feel like you belong here.
Overall, the federal government, in its statistics, has designated us as one of the top 10 hospitals in terms of overall outcomes in the nation for the last couple of years. And so I really believe that our residents get to see the highest quality care that can be delivered in both the inpatient and outpatient settings.